Hi everybody, in this video we are going to look at the prioritization part 2. So I was explaining in my previous video about the prioritization and there are some more rules which we have to consider for solving our prioritization questions. So these are not the rules, these are basically the guidelines which will help you to solve your questions easily and in a better way, and for most of the time they work. So let us take a look at these rules. So we have one patient. So for example, if you have one patient in a question and you are given the sign and symptoms, 4 options as sign and symptoms in the option box, then look for a diagnosis in the question. So this is one thing which we consider while solving the questions related to the prioritization. We have options, 4 options, which contain sign and symptoms. But in the question, you have diagnosis. So for example, let us consider this example. The patient is hypertensive or he is having hypertension. So the diagnosis given in the question will be of hypertension. And if you look at the options there, in the options you are given sign and symptoms. Now you have to choose what is the priority in this. So if you have a diagnosis in a question and you have sign and symptoms in the option, I'll say look for what is expected out of the diagnosis. For example, we know this person is suffering from hypertension. So the expectation related to hypertension, this person will have increased blood pressure, obviously. He will be having headaches and epistaxis, means nosebleeds. So he will be having high blood pressure, headaches and epistaxis. So this is something which we already know is expected out of the diagnosis. But how do we differentiate? So this is the only one thing, dysuria, which is not related to hypertension, and this is unexpected from the diagnosis. So if you don't expect something out of that diagnosis, that certainly is your priority. So this is unexpected and at the same time not even related to the diagnosis. So one thing is this. Another thing which we will look for is that in case if in a question you have sign and symptoms. So you have sign and symptoms in a question and the question says to report a behavior. For that, what would we do? Now we'll look for changes in an option. So we have to report a behavior. For reporting the behavior, we'll look at all the options. What behavior do they show? And then we'll look at sign and symptoms in a question. So any behavior which is deviating from the sign and symptoms in an option, in a question, is your right answer. For example, if the question says the sign and symptom is, one of the sign and symptom is blood pressure. So the blood pressure of this patient is 160 by 90 millimeters of mercury in case in the questions. Now we'll look at the options and there we'll see how it has changed. And in case in option, if you see it has gone from 160 by 90 to 200 by 140, which is way more higher as compared to what we had in the question. So this is something that has changed. Now that is the priority. So look for sign and symptoms and look for the behavior that has changed from the one that was given in the question. And another, last but not the least, so here we'll look at the question, and in the question we will be given diagnosis with the sign and symptoms. So we have diagnosis of the patient given in the question along with the sign and symptoms, and the question says address an issue. Pick an issue that needs priority. So there, from the options, think objectively. What can you see? So what we can see is, then last but not the least, so in question, if you have diagnosis and sign and symptoms, so you have 2 components in the question. You have diagnosis, you have sign and symptoms. Now the question asks you to address an issue. You need to look for something from the options that needs priority. So in that case, think objectivity or think objectively. So look for sign and symptoms that can be measured. For example, you have diagnosis and sign and symptoms in the question related to something with malnourishment, dizziness, nausea, and dehydration. Now you need to address an issue. So you need to look for something from those sign and symptoms in the question. Out of all those, what would you give priority to? Think objectively means look for something that can be measured. For example, malnourishment, dizziness, nausea, dehydration. Can you measure malnourishment? No, we cannot. Can we measure nausea? Because this is just a feeling, we cannot. So dizziness, no. So we cannot measure these three things, right? Leftover is dehydration. Can we measure dehydration? Well, yes, because we can look at signs and symptoms of dehydration. Now, this means this is something which is objective, and we need to make this our priority, and this will be the right answer, and we are going to mark dehydration as a priority because this is objective. Now, other than that, we need to follow the principle of P in case of choosing if the options do not relate to ABC. PSCP: physiology, safety, comfort, and at last pain or the psyche of the patient. So this is something which we are going to take. So I'll say think of principle of PSCP. PSCP principle means physiology, safety, comfort, pain, or psyche. If you don't find ABCs in the option, look for physiology. Is it subjective symptom? Is it objective symptom? If you have objective symptom, if it can be measured, that is a priority. And then we have subjective. Then look for something related to the safety. Is the patient safe? Is his safety at risk? That is going to be the priority. Is he comfortable? Is he not in pain? That is our priority then. And at last, psyche, his emotional well-being, is the last. So ABC principle, PSCP principle, and looking for things like questions and sign and symptoms, whether they are in the question, whether they are in the options, how do they relate to each other, how do they differ, and if they differ, what is the difference, whether that makes sense with the question, or if it is something which is related to that in the question. All of these things make a difference, and these are exactly the things which will, if not all the time, then for most of the times, they will for sure work, and they will help you land in the right place, and you will be able to choose your right answer. I really hope that helps. Thank you so much for watching.